I was really, really, really hoping that we would find that one of those drugs did us good. And I retain hope that as this work continues, we'll find that one magic drug which makes us both safer and happier. I'd like to welcome Professor Cuong Pham to talk to us about helmet use. Professor Cuong Pham is an associate professor and head at the Department of Scientific Research Management at the Hanoi School of Public Health.
Good morning, everyone. And first of all, I would like to thank you for the International Injury Research Unit, Johns Hopkins University, that invited and allowed me to give presentation from here. And I will go into present example of helmet use in Vietnam. I'm not talking in general, in global, because we want to take the Vietnam as a case in the helmet use, because we already been in quite a long time to promote the helmet use among the motorcycle user in the country. And we found a lot of success and also a lot of fail. So we want to introduce you here. I'm going to talk about some problem of road traffic injury in Vietnam. We talk about the mandatory helmet policy, also some figure of helmet wearing, and also some result that we evaluate the policy. And we also found some issue, and we will talk about a lesson we have learned in the past more than 10 years. So I think you know in Vietnam, but just briefly, that we are in low and middle income country, and we have about 89 million population, and we are in Southeast Asia. It's quite a large country in Southeast Asia. But we also have in the last couple of decades, more than about 2 or 3 decades, our economic is growing quite fast. And we also found the problem with our motorization issue. It's going very fast together. And currently in 2014, we have about 39 million motorcycles registered in Vietnam. It's around almost 500,000 in Vietnam. So about every household, they have about from 1 to 2 motorcycles in the house. And the main transportation of population of Vietnam is motorcycle. And road traffic injury, it contributes to the largest burden of death and daily in Vietnam, especially affect to the young and the work population. And we also have that every year about 12 to 14,000 people die because of road traffic injury, and about 500 million people they admit to the hospital because of road traffic injury. That's a huge burden for population of Vietnam. Here's some figures going quite fast, but just up to the 2007, and you see that the rapid growth and the continued trend in Vietnam, because our government don't have any policy or regulation to stop or to stable the trend yet, still going up in the motorization in the country. And we also see the road traffic injury. It costs about 14,000 people die, and especially affect the group from 15 to 49 and 60 year old, the population. And for the people, it's not die. About 500,000 of them go to the hospital. And you see the road traffic injury caused by different type of transportation. And you see that the majority of the call, it become motorcycle. That is a big issue in the country. It attribute for about 75% of the injury is related to the motorcycle issue. We have a lot of efforts to prevent road traffic injury in the last 2 decades, and one of them is the mandatory helmet use in Vietnam. We have the National Traffic Safety Committee established in the year 1997. We have a lot of efforts from the international, the national organization. We introduced the helmet use, it mandate in traffic law in 2001. But at that time, after several years before we cannot increasing the rate of helmet use. It's always like a 3 to 5%. There are many issues. For example, that there are no available appropriate helmet for the tropical weather in the country. And the cost of helmet is very expensive and people not afford to buy. So at that time, after 7 years, we not be able to increase the rate of wearing helmet in the country. Is always stable about 3 to 5%. And then in 2007, there are two picture in just only between couple days. So December 11, 2007, and you can see December 15, 2007, two different pictures in the country. And because of, in the December 15, 2007, the mandatory helmet law in Vietnam become effective. And we're increasing the rate of wearing helmet from 10 to 95%, just one night. And I think that is an amazing success of Vietnam at that time. Lots of attention new around the world. People mentioned a lot about how the Vietnamese people can do it in just a quick time. There are many reasons what make it possible. In the before 2007, about 5 or 6 years, we do a lot of study and advocate for the government. We based on the data to see the effectiveness of helmet, the quality of helmet, and try to do how to make the good helmet with reasonable price for the population. Lots of data coming out, and we have the advocate for government, and we have the very high political commitment from the prime minister and the top political leader in the country. We have the good enforcement from police, and we communicate before December 15. Almost 1 year, we communicate that the December 15 is the day that you need to wear the helmet, and we're increasing. And we also make the availability of the appropriate helmet for the tropical weather and the region price. And we see that from 2007 and we up until now, the rate of wearing helmets for the driver and passenger is still stable and in the very high, up from 80 to 95% in the population. But we also have some study to show why people wearing helmet, and we found out that it's not all of them wearing helmet because they think that it's good for their health and protect their head. Very large proportion of them wearing helmet because they are afraid of fine from the police. They're afraid of cost, and that can cost some money. And we also evaluate, is this effective for the helmet in Vietnam? So, and we did a study to compare the data from the hospital for the head and face injury in the hospital and the observation of helmet use in different provinces in Vietnam in different point of time. And we compared the 5-year study, and we saw that it's significant increase in helmet wearing, but we didn't see any difference in the rate of head and face injury in the hospital. And several studies, we're still showing helmet wearing is going up. Also, some of them is going down, and injury rate is still going down, up in some area. And in Da Nang, in the big hospital in Da Nang, in several years, in 5 years, we compare the rate of head and face injury and the helmet observation result. We didn't see any reduction trend in here, still going up, still going up. So what happened? That is a big question for our people in Vietnam. So why the rate of wearing helmet is very high, but we didn't see the reduction in head and face injury. If that is some reason we find out. One of the big problems is the incorrect helmet use. Even the people put in the helmet in the head, but I think that it to avoid the police, it's not to protect the helmet, so they not wear it properly. The second is non-standard helmet. And the third reason we found out the child helmet use. So what happened with the incorrect helmet? You can see in the picture. People wearing helmet like this one, and if they go in the road, if something happened, the helmet fell out and did not protect at all. There are several figures that you can see that people in Vietnam, even some minority group, because traditionally they have some traditional in the hair, and when they put the helmet, it's not proper at all. And here's a study in the IF10 project. We see that the rate of correct helmet use among drivers is always like from 40 to 70%. So about 20 to 30 to 60% of them is not the correct use of helmet. The second issue is the non-standard helmets. We see that the rate of wearing helmet is quite high, more than 80%, but half of them using non-standard helmet. In many ways, for passenger and also for driver, half of them is not wearing standard helmet. What's the non-standard helmet look like? You can see it's very thin, it's no protection at all, and it's very easy to broken down. It looks like a cap, it's not the helmet. And we also try to test the quality of helmets that people use by using the roadside survey, and we exchange the standard and new helmet for people, and we get the helmets they are using, and we come back to the lab and we test, and we see that the cap helmet is the label as C, very low in many indicators for the parts, the size, the weight, the impact that could prevent the head. And the other kind of helmets as well is also not really good to protect the injury, the head injury. And all of the helmet we collect in the road, proportion of qualified helmet by different helmet type in Vietnam is still very low. Except like a full face helmets, it could be like 50 or 60%, but other type helmet is very low in terms of quality. And we also see that in our IF10 project for intervention, we're also looking at the non-standard helmet use. And in the last couple of years, we see that also when using the social marketing, we can reduce the proportion of non-standard helmet use in the country. And we hope that we can do it better in the coming time. The child helmet use. Because by the law in Vietnam, children not wearing helmet, they will have no problem because the police did not catch them. And recently, they add one of the conditions that the children from 6 years old and up have to wear the helmet. But in the past, there are no regulation for the children to wear the helmet. So you can see that the mother wearing helmet, but the children don't do it. And you can see it several issues in Vietnam. And children, our observation studies show that almost like more than from 20 to 50% of children not wearing helmet when riding motorcycle with their parent or adult. That half of them is not wearing helmet at all. And we also doing some intervention the side, and you can see that the children wearing helmet, proportion of children wearing helmet is also reduced. It's difficult because the government is sometimes they try to increase the rate of helmet use among children, and they not keep the enforcement or the efforts regularly, and the rate is going down because without the enforcement it could be a problem. And the reason it's not wearing helmet among children because sometimes people forgot to wear. Sometimes children don't want to do it, and some parents we don't need to wear the helmet for children because it's safe. I can cover them if something happens. And the helmet for children is also not available and quite expensive, especially for people in rural area. So what we learned from the helmet use in Vietnam, we see that the policy can be a very important element of behavior change. Because before the mandatory helmet law in 2007, we tried to do a lot of social marketing, advertise the effective of helmet, but without the policy and enforcement, I think people are not wearing at all. And the second point we want to discuss is we must be sustained and supplement the policy. Because the policy at the beginning very good to raising the helmet use, and we need to sustain it. And when we introduce the policy, there are some issue. For example, child helmet is not introduced at the beginning. We need to revise. We didn't find any problem with non-standard helmet at the beginning, and we need to revise the policy, and we need to revise the enforcement strategy. And we need to, based on the knowledge, we need to have the data evaluation to show that it's effective and how to keep the work run. And regulation must be clear and easy to understand and need to well communicate for the population. And needs to also this own essential piece of legislation. For example, you need to have the helmet law, you need to have the regulation to fine, you have to have the child helmets, and quite a lot of things you need to introduce at the same time. And we also have lots of partnership between among the agencies in Vietnam, for example, the transportation, the health sector, the commercial, and some people in Vietnam. And also we have the global and local interaction, because at that time in the country, we work very close with like a WHO, UNICEF to raise the problem with the helmet among children or helmet among the motorcycle rider, and we amplify the policy. Very good. And we also have a lot of experience on public-private relationship. When we introduce and we allow the people for the public service to produce the helmet with the good quality and the low price, and I think that also make it the policy in Vietnam is running quite well. Yes, that is his experience from Vietnam, and thank you very much for allowing me to be here, and hope we can answer some questions. Thank you.